again, as Adam said, my name is Rachel Woodhoff. I'm a healthcare eligibility policy analyst at the Wisconsin Department of Health Services. I will be starting out with the first part of the presentation today, and then I'll turn it over to my colleague, Michelle Furr, who can continue then with the rest of the presentation. So today's agenda, we'll just go over the purpose, program basics, how to apply for Wisconsin's healthcare programs, what to expect after applying, outcomes, and resources. All right, so the purpose of this training is to provide navigators, certified application counselors, partners, agents, and brokers with a basic understanding about how to apply for Wisconsin's healthcare coverage programs and what to expect throughout this application process. Just to note, as Allison and Adam had mentioned earlier, we do have other sessions this week that Michelle and I will also be presenting on. So session 2 will focus on eligibility rules for Badger Care Plus, and that will be the session following this one. And then session 3 will be tomorrow, and that one will focus on eligibility rules for Medicaid for elderly, blind, or disabled individuals. You may have heard of that as EBD Medicaid, but again, that will be covered tomorrow morning. All right, so getting into program basics. So available programs. So first off, Badger Care Plus, it covers children ages 0 through 18, parents and caretaker relatives of children ages 0 through 18, pregnant women, and childless adults ages 19 through 64 who are not receiving Medicare. And just a little more information, by childless adults, we mean adults in this age group who do not have minor dependent children in their home. So they may have children, but just not qualifying for a different population like parents and caretakers. And Medicaid for elderly, blind, or disabled individuals, or again, EBD Medicaid, covers adults ages 65 and older, individuals who are blind, and individuals who are disabled. So most of Wisconsin's healthcare programs are administered by a network of county and tribal income maintenance, or IM, agencies. And you may have heard of this as a consortia, your local consortia, maybe your local economic support agency. There's many names for these agencies. But IM agencies process applications, they make eligibility decisions, and they issue benefits. All IM agencies use the CARES eligibility system to administer benefits. So CARES is the name of our eligibility case management system. All program rules are the same statewide, and applicants are assigned to a specific agency based on where they live. So it is geographically based. So again, most county IM agencies are organized in 10 regional consortia, and there's a link here so you can look in and see the map of where sort of where each county falls within the consortia. A couple of exceptions. So Milwaukee County IM is administered by the Wisconsin Department of Health Services through the Milwaukee Enrollment Services, otherwise known as MILES. And the Menominee County IM is administered by the Menominee Indian Tribe of Wisconsin. So eligibility determinations. When someone applies for healthcare coverage, the IM agency considers whether the person meets all of the non-financial rules for healthcare programs. For example, is the person a US citizen, or does the person have qualifying immigration status? And whether the person meets all of the financial rules for healthcare programs. For example, does a 67-year-old applicant have assets below the EBD Medicaid asset limit? And as you can probably tell, these rules differ by program. So, so just because somebody might meet a certain income limit or asset limit or non-financial rules for one program, it doesn't always, directly translate to, and now they're automatically eligible for other programs as well. So there are specific rules, and actually in our following sessions that I had mentioned earlier, we'll be going over those non-financial and financial rules in more detail in sessions 2 and 3. So based on the individual situation, which specific healthcare category is the most appropriate? That's one of the things we look at. So example, does a person qualify for Badger Care Plus or a type of EBD Medicaid, depending on the information in their financial and non-financial situations? When someone applies for full benefit health coverage in Wisconsin, they do not have to specify which program they are applying for. So really, the expectation for people is they're applying for healthcare in general when they come in and apply. They're not having to tell us, well, I think I'm eligible for this program. That's not something they need to do. They just apply for healthcare, and then the income maintenance agencies and the care system are able to take that information in an individual situation and sort of figure out which category is the most appropriate for them. If someone is not eligible for Badger Care Plus or EBD Medicaid, as you probably know, they might be eligible to enroll in a qualified health plan or QHP at the marketplace. Their application will actually be transferred automatically to the marketplace. So if they apply with us and they're not eligible, we might be able to send their application to the marketplace automatically. And so they don't, it saves them a step of having to apply separately at the marketplace in those situations. All right, Adam, I think I'm going to take a break here. Are there any questions coming in through the chat?
I am not seeing any related to the content that you just gave. I did get a few technical ones that I got out of the way. Will you be going into more detail about like the transfer process for Badger Care to the marketplace or anything like that during this session?
Not on this session in particular. If there are specific questions, we can see if we can answer them. And if not, we can take it back, or we have another, we'll show where people can send questions outside of this presentation. So there are, I mean, it does get a little bit technical. I think there are some criteria that I unfortunately wouldn't be able to say off the top of my head as far as which applications necessarily are transferred. But we could, if there are specific questions, we can certainly take a look at those and take them back if needed.
I will try not to just add my own questions to satisfy my own curiosity, though helpful I'm sure they would be. I will do my best to just advocate for the people attending today.
Sure. All right, so getting into applying for Wisconsin's healthcare programs. So for filing an application, a person may use any of the following methods to complete and submit an application. So you can go online at access.wisconsin.gov, in person or face-to-face, which I know is maybe difficult or may not be a preferred option for folks at this time, phone, and then paper application. So the filing date is a term you may have heard, but the filing date is the day a signed healthcare application is submitted to the income maintenance agency. In most cases, eligibility starts as of the first day of the month in which the application was filed. So if somebody were to file an application today, September 21st, we would look at their eligibility for healthcare starting September 1st. So the first of this month, this is sort of the application month. And I know that's different. There's some programs that will prorate, so they would not look back to September 21st. They would look at September 21st. Or excuse me, they would not look back to September 1st. They would look at September 21st as the filing date, but and the date that benefits would start. But healthcare, we do look back to the first of the month in most cases. Applicants can also request up to 3 months of backdating for most programs. So, so if I were to apply today on the 21st, I could also request backdated benefits or eligibility for the previous 3 months. So that would be August, July, June. So I could have eligibility go all the way back to June 1st, possibly, if I did meet eligibility requirements for those months as well. Some pregnant women who are immigrants or inmates, as well as children with higher incomes, do not qualify for backdated coverage. So there are some limits on certain populations where we would really only look at the application month and going forward. IM agencies have 30 days from when they receive the application to determine eligibility. So that just to give you sort of an idea of up to how long it could take. Again, some agencies do not take that long, and so sometimes people could hear back earlier than that. So everyone applying for or receiving Badger Care Plus or Medicaid has the right to be treated with respect by IM agency staff, have their civil rights upheld, have their private information kept private, get an application or have the application mailed on the same day it is asked for, file an application right away, even if they are not in the correct office, and get a decision about their application within 30 days of the day the agency receives it. Again, that timeline. Responsibilities. So everyone applying for or receiving Badger Care Plus or Medicaid is responsible for providing accurate information, providing proof of information when requested, reporting changes as required by the agency. And then there's a number of other responsibilities, but for more information on the rights and responsibilities, we do have the Enrollment and Benefits Handbook, and the link is there. It's publication 00079 if somebody were wanting to look that up on the DHS website. Okay, so going into methods of applying. Again, I listed these off earlier, but a little bit more detail. We have applying online through Access. You can see the address below, access.wisconsin.gov. And here's a screenshot of it. I know we had a refresh of Access within this past year, sort of the look and feel of it. So if you had worked with Access in previous years, had assisted people with applying, or just poked around on it a little bit, you may notice that it looks quite a bit different on this homepage. The same functionality should still be there, but it just might be a little bit different looking. So just to warn you if it's been a few months since you've looked at it. So access functions. So as you may know, there's a few different things that you might find helpful there. So there's Am I Eligible, which is a short screening tool that you can use to find out which benefits you or the person you're assisting might be able to get. There's no login needed for this. And it's just sort of like a quick screening tool. So it doesn't require the full application, but just sort of getting at some of that more high level information to sort of get an idea of what you may be eligible for. And it does include sort of an assessment on more programs than just DHS. So there are more programs for other public assistance out there. That it does look at that as well. So there's also Apply for Benefits, which is how you apply online for healthcare, food share, childcare, and or W-2. So that's the actual application there. And then in some cases, just to know, applicants may actually be able to get an immediate eligibility decision for healthcare. So if we are able to sort of confirm all of your information on your application, we might be able to actually give you your eligibility determination right there, and then it doesn't wait for that, up to 30 days for the income maintenance worker to process that. So that is a feature there. For the Access account, so that is also useful for managing ongoing benefits as well. You can check your benefits, renew your benefits, report changes, view notices, and perform other benefit management functions. This one you will need to create and authenticate and use an Access account. So this one you will need to actually have that login and user ID and other information to create that account. Members can also check their benefits and do benefit management functions on the My Access mobile app. We'll be talking about that a little bit more in the presentation about what the features are for that. All Access pages are available in Spanish by clicking the Espanol link up in the corner. Detailed help text is available through the help button on each page. So that kind of gives some more information about what you might be seeing on the page or what information you may need to provide. And partners can test drive Access by using the Access training site. So it's similar to the Access site, but it's got TRN in front of the access.wisconsin.gov. Just important notes, this is a mock version of the live Access website. This training site does not create a valid application, so make sure you're not in this training site if you're actually trying to submit an application. And it should only be used for testing and training. And if you are trying to do a mock application, make sure you are in this training site and not in the actual Access site. So sometimes folks have accidentally done, one or the other. And you will know when you get into the Access training site, it should say training up here at top and sort of have this banner about testing Access and teaching people how to use Access. So that's how you'll know that you're on the training site and not on the real site. Walk-in and telephone. So individuals have the option to apply in person at their county or tribal IM agency. They may also apply by phone. Each consortium has a central phone number for taking applications and other customer services. And then at the DHS website, we do have phone numbers and office locations for whatever office or local number that you need. Mail-in applications are also known as the paper applications. Individuals can apply by mail. Just to know, I know I said earlier that you really are just applying for healthcare, but for the paper application, because they have different eligibility rules, Badger Care Plus and EBD Medicaid do have different application forms that specifically sort of ask the Badger Care Plus information and specifically ask the EBD Medicaid information. However, either application can be used to make a request for full benefit health coverage. So, for example, if you happen to fill out the Badger Care Plus paper application, but you really should have maybe filled out the EBD Medicaid application because you're over the age of 65 or 65 or older, that's okay. We will still, look at that as a request, and then we would follow up, or the agency would follow up with you to gather any information needed specifically for EBD Medicaid. So we would not say, reject the application and require you to fill out a whole new one or anything like that in that situation. All right, I think it's time for poll question number 2.
Yep, and it has appeared for everybody. Yep, it looks right to me. It says 1, but it is not the same question as before. You guys will notice, so go ahead and answer that. And just a reminder, I did get a couple more questions along whether or not this is being recorded. Yes, it is being recorded. We will be able to post this on our site later via probably the conference webpage. There'll be access to the different presentations. Mike will definitely communicate the logistics for all of that, probably at the end of the conference or during some of the announcements that happen during the conference. And the slides themselves are going to be saved as a PDF that people can also download and access later. All right, looks like, Rachel, we got 39 responses. Are you able to see that?
Yes, I am.
Okay. So would you tell everybody what the right answer is?
Sure, yeah. The right answer is E, all of the above. So
Yep.
Good job, everybody. Yeah. Yep, good job. So I think at this point, I think is our transition over to Michelle. So thank you, everybody.
Thanks, Rachel. So Mike will just take a second to switch, make Michelle the presenter, because we can only have one presenter at a time. Hopefully that answer from everybody means that you're all paying attention and picking up all of this info. Let me open chat back up just to see if there are questions. Anything I missed? Nope, mostly about the technical stuff. All right, and we can see the next section that Michelle is sharing.
Okay. Adam, you can hear me?
Yes, can.
I hate to ask that, but I felt like I had to.
No, you definitely worth doing.
Okay, all right. All right, hey everybody, I'm Michelle, and so we're gonna continue on and talk about what to expect after someone files an application. So verification, before the IM agency makes a decision about eligibility, they have to verify the information that the applicant has reported. And in lots of cases, and whenever they can, the IM agencies will use data exchanges to verify information. We often verify citizenship, immigration status, sometimes earnings from a job, unemployment, Wisconsin unemployment benefits, Social Security income, supplemental security, SSI income, and child support payments that are in Wisconsin. And then in other cases, applicants, we ask them to submit proof of what they've reported. And applicants have a lot of ways they can submit that. They can submit the verification or proof by fax. They can submit it by mail. They can drop it off in person. And some agencies even have a drop box out front. They can also use Access MI Access. We really encourage people when they can to use Access MI Access. It submits the document to the IM agency right away. There's no, mail issue. There's no Dropbox issue or anything or delay. My Access allows people to actually use their cell phones to take a picture of a paper document and submit it. They don't even need a scanner, which is great. So the verification checklist, the agency sends the verification checklist. We call that a VCL. The actual piece of paper that someone gets is called a notice of proof needed. I'm going to call it a VCL from now on. So verification checklist, we list the items that are needed. The VCL will also be sent if the agency is missing information needed to make a decision. So maybe it's not necessarily proof, but maybe there was a question that was missed by the applicant on the application. We would send a VCL if we need something. An applicant does not provide, if the applicant does not provide the requested verification, then the application is denied, and it's typically denied for not providing proof. So you told us stuff, but we didn't get the proof that we needed to be able to verify that information. So the verification checklist, again, it lists verification requirements for Badger Care Plus or Medicaid. Also food share, if that's applicable. If someone applied for food share, then it will list what's needed for that. Sometimes those are different than for healthcare. It provides the due date or due dates that we need the person to provide the information that was requested. It contains specific examples of documents that are needed. This doesn't mean that a person's limited to providing those specific documents. It just is trying to help people by giving them an example of the document that could be used to verify. Also includes a document tracking sheet, and that can be used to submit documents, particularly by fax. So here's an example of a VCL, and you can see it says notice of proof needed. It doesn't say VCL, and it says, to get or keep your benefits, we need you to provide information. I'm not going to read it to you, but anyway, and it explains right there at the top that if the person does not provide the proof by the due date, that benefits will be denied, decreased, or ended. And then it talks about the document tracking sheet. It shows the program, it shows the due date, it shows the contact information of where to send it. And then this is another page on that. We've kind of broken it into a couple of pages. And it says proof needed, here's what we need. This person needed verification of employment at Walmart, and this person needed verification of self-employment at a bakery. This is, of course, a fake example. And for the employment, it shows an example of what could be supplied. It could be pay stubs from the last 30 days. Could be the employment verification of earnings form that was sent to the person with this VCL. Could be a statement from the employer with the same information. It's for Badger Plus, and it shows the due date. For self-employment, the example is the enclosed self-employment income report form. Another example, depending on the business, would be tax forms. And again, for Badger Care Plus, and it gives the due date. So what are the possible outcomes once somebody applies? There's a notice of decision that's sent after the income maintenance agency has verified the information reported on the application. The agency makes a decision about eligibility, and the applicant will receive a letter telling them if the benefits are approved or denied. That's called notice of decision, NOD. You may also hear it called. The NOD, notice of decision, includes the following information. It includes a summary, which lists the benefits that have been approved and denied, as well as the contact information for that person's IM agency. It lists the benefit details, like who's enrolled, the dates they're enrolled, who's not enrolled, and if someone's not enrolled, why they're not enrolled. It also shows household income and deductions, and the sections for this list the income and deductions on file for the household. It's always a good idea for members to check that to make sure it's correct in case there was somebody miskeyed something, or the member, if they did a paper application, the handwriting wasn't legible, or they miskeyed something on the application in Access. It also shows how we counted the income, and we list the amounts and limits that were used to decide whether the member is eligible in that section. It also shows, this is really important, it shows the members' reporting rules. So if benefits have been approved, this section tells members what changes need to be reported to the agency and when. It's really important that members contact their IM agency or report the changes, or report them through Access Changes reported to member services. So this is really important. Changes reported to member services, which is the phone number that's on that forward health card or at HMO, are not shared with the IM agency. They're not shared, and sometimes they might not even know that they need to hang up the phone and call the IM agency. So it's really important that everybody put out the same message. If you need to report your changes, you need to call your income maintenance agency. So the notice of decision also has a key contact section, and that provides information about who members should contact with questions. And also, of course, a fair hearing section. It's the last page of the notice, and it provides information about fair hearings, including the date by which a hearing must be requested, and also how to ask for a hearing if they want to. So let's talk about fair hearings just a little bit. If benefits are denied, reduced, or ended, and the applicant or member believes that the IM agency made a mistake on that, they contact the IM agency. That's the first thing they should do. So the applicant or member can ask the agency for help in requesting a fair hearing if they disagree with what the agency tells them when they ask about it, or about the results of their eligibility. And the applicant or member can also directly contact the Division of Hearings and Appeals to request a fair hearing. There's no wrong way to request a fair hearing. They can contact the IM agency, they can contact the Division of Hearings and Appeals. There's no judgment put on them by which method they contact someone to request a fair hearing. And then at the hearing, a hearing officer will hear from the applicant or member and the agency to find out if the decision was right or wrong, and they'll require the agency to take action if that's appropriate. After the hearing officer will send a written decision to the individual and the agency. The written decision has a discussion section, it has an appropriate laws that are listed, and then it has a decision section too. So the ALJs do a really good job trying to lay out why they made the decision that they did. They don't just say, you win or you lose. Adam, I'm just going to pause and just see it. I didn't see anything pop up, but is there any comment, question? Sorry.
Yeah, I also have not seen any new ones come in. Just a few private ones about technical stuff still, but I will say just a note on like the notice of decision for assisters, for new assisters who don't know this, will be looking at a lot of those, because oftentimes what happens is you'll get a consumer who comes to you and they will bring all of their mail from the IM consortium and they will show you everything. And one of the most important pieces of paper for you to find will be that notice of decision, so you can see, okay, what did they count? How was it counted? Did the consumer miss anything? Did the IM agency miss anything? How big is the household? What was, I know you guys will go into more detail about counting households and all that. So you'll get the experience needed to answer those questions, but just know that you'll be looking at a lot of notices of decision in the future.
Great, thanks, Adam. I think it's a really good point. Okay. So someone is receiving services. Each eligible person receives a forward health card, which can be shared with providers when services are requested. So someone calls on the phone to make an appointment. Perhaps the provider will ask for the forward health card, the forward health card number. Or perhaps they go into the doctor, they would hand over the forward health card like any other insurance card. If someone has received a forward health card in the past, they will not get a new one unless they request it by calling member services at the phone number, and that phone number is on the card. So I think that's important, that I can imagine that members might think that they get a new one every year, or they get a new one when they reapply. Let's say that they were closed for a minute. Adam, can you still hear me? I'm getting an odd...
I can hear you okay.
Okay, I just
heard an echo on myself, but I'm not hearing it anymore.
Okay, I wonder if it said something about low bandwidth in video. Should I turn my video off?
It can help, and it might prevent some issues that we may otherwise be headed for. So go ahead.
Okay, I'm going to try to do that. Bear with me. Sorry, everybody. Sorry, maybe I don't know how to do that on with the screen that it's giving me.
Yeah, I'm not exactly sure what you're seeing. Mike
Yeah.
probably answer that. On mine, stop videos at the very bottom.
Yeah.
So Michelle, when you shared your screen, at the very top of your screen, there should be a little drop-down menu. If you hover over the top, that should give you the option to stop sharing. And through that, believe to the right, in that same drop-down menu, it should have an option to stop video.
Okay. I just have to find that. I'm sorry, everybody.
Actually, let me see if I can do something real quick.
Okay, thank you.
Okay, actually, I just stopped your video, so you should be all good.
Wonderful. Thanks so much. It's just got confusing because it's showing me my PowerPoint thing. So, okay,
Yep,
thanks so much.
yep.
I appreciate that, everybody. Thanks for your patience. Okay, so back to the slide presentation. So the number is on the Forward Health card, and if someone needs to use that, needs to get a new one, maybe they can't find their other one, or they have it, which is how they have the phone number, and they need a new one, they can call. Also, all of you will probably have this number handy when you're helping people. If not, you can do a quick Google for Member Services Wisconsin, and it will come up, or Forward Health in Wisconsin, and that number will come up. So 800-362-3002. All right, covered services.
Real quick, Michelle, how long does it take once somebody requests a new card to get a new one?
Adam, that is a great idea, and I don't know the answer to that. I'm sorry. Rachel, do you know the answer to that?
It should just take a couple of days.
Oh, thanks, Maciel.
Yep, that's why we have Maciel on.
Yes, that's
Yeah.
right. Thank you so much, Maciel.
No, absolutely. It should just take a couple of days, but just remember a new Forward Health card will not be mailed out when you sign up for benefits. Again, they expect you to keep those in a safe place in case you become eligible with Care Plus in the future.
Right. Most people aren't going to be thinking that way. Most of them are going to toss theirs out. So if you're in a position to explain that to somebody, go ahead and do that.
And all they have to do is call.
Exactly. Otherwise, call.
That's a great point, Maciel, that if someone is assisting someone with their healthcare and applying, that just to remind them, hey, just, keep it in a safe place, like where you keep your Social Security card or something. That's a great point. All right, so covered services, this is always a question. Does Care Plus or Medicaid cover, for example, dental services? It does. But covered services are listed in the Enrollment and Benefits Handbook. We have a link on the screen to this. Also, for a member, when a member is enrolled in our healthcare coverage, they will receive the Enrollment and Benefits Handbook, and they'll receive it typically once a year. So there are updates made throughout the year, and they will typically receive a new one once a year. So that's I would encourage people to keep that if they get it. It's very lengthy, but it's a lot of information in that document. It can also be found online, obviously, through the link that we provided here. So some services might require prior authorization, and the provider will request the authorization on the member's behalf, which is great news for the member. So for some services, members may be required to pay a copayment or copay. Most copays range from 50 cents to $3, and providers may make a reasonable effort to collect the copay, but providers, this is really important, providers may not refuse services if the member does not pay. So let me say that again. If the member says to the provider, I'm sorry, I can't pay that, the provider, certainly can ask again, but they cannot refuse services. If the copay was supposed to be paid later, it was not paid later, again, the provider cannot refuse services in the future because the person didn't pay that copayment. So I want to make that really clear. So for questions about covered services or for help finding a Care Plus or Medicaid provider, again, the member can call Member Services at 800-362-3002. All right, sorry about that. Okay, renewals. Let's talk about renewals. All right, renewals are done under more circumstances every year. So members have to renew their eligibility every year. The renewal process can be completed online, by phone, in person, or by mail. Members do receive a letter with instructions about completing this renewal about 45 days prior to the end of their 12-month certification period. And in some cases, eligibility can be renewed through what we call an administrative renewal. Administrative renewals occur when the IM agency is able to verify all the information through data exchanges, and then members must review a summary of the information that we use to renew their benefits, and they have to report any changes to the agency within 30 days. So let's say that I'm a member and I am fortunate enough to be renewed through an administrative renewal. I will receive a summary, and it's my responsibility to go over that summary, make sure it's correct, and if it's not correct, I can call the agency, or I can write out the corrections on that page and then send that in to the agency. But I need to do that within 30 days of being sent that document. Okay.
Michelle, I got a question about the copays, just circling back to a couple slides ago.
Okay.
If the consumer, the member, doesn't pay the copay, can the provider then bill them? So that can they be balance billed for the missed copay?
I believe the provider can take any reasonable measure to attempt to get the copay. So I believe they could. Maciel, I think that certainly they could send them a bill, right?
Typically, copays is for fee-for-service folks. Most of the HMOs waive the copays, so it doesn't happen very often. But I do believe that can be they can request the payment. Usually, the amounts are minuscule, so they're not sought after. However, if there are questions with that, if anybody continues to have questions with that, please just let us know and we'll look into that further.
Sure. The follow-up question to that is, can the unpaid copays be sent to collections?
Yeah, we're going to take that one back.
Okay, cool. I also don't know. I don't think in most cases that they would do that, because you'd be talking about some really low amounts. It probably wouldn't be worth it. But just the important thing also is to remember that they can't be denied services for unpaid copays.
That's right. Thank you. Thank you, Maciel. Thank you, Adam. I appreciate it. So I've got a slide on the, we're going to talk about the COVID-19 emergency period, the public health emergency period. And I just wanted to say that we will have more information on this. We're going to get into more, I'm just going to go over this briefly, but we're going to get into details in subsequent sessions. There's an in-depth presentation on October 5th about the temporary changes that we have in place that are due to COVID-19. So that's October 5th. And one of my colleagues, or possibly my section manager, is going to present that information. But let me tell you just briefly about it. So we've got temporary changes that were made to Badger Care Plus policy and to Medicaid policy during the federal public health emergency. And they include maintaining eligibility for existing members. We are postponing renewals. We are made some changes to verification requirements. We have suspended premiums. We have suspended the treatment needs question requirement for childless adults. And I think Rachel's going to go into more information about that in her Badger Care Plus talk. And then we have added the elderly, blind, and disabled adult population to presumptive eligibility. So some changes made for COVID-19. And again, on 10/5, there will be a detailed session on that. All right, additional resources. So MyAccess mobile app. Members with authenticated MyAccess account can download the MyAccess mobile app to do the following. They can check their benefits. They can see the programs that they're enrolled in and when their next renewal is due. They can get reminders. They can be reminded of actions that they need to take or documents that they need to submit, which is a great feature, I think. I like reminders on all my apps. And then they can submit documents. And again, we mentioned this before, but they can take photos of a document. They can submit the proof at any time and then check its status in real time on this MyAccess mobile app. And they can download this, of course, for free at the App Store or Google Play. And I would really, if y'all could just encourage people that you talk to who are going to become Medicare Plus or Medicaid members to please download this. They would apply for a My Access account on the Access application process, and then they can download this app. And I think it's very helpful. And we certainly are hopeful also that we can expand its abilities in the future.
Michelle or anybody, do you want to describe quickly what the authentication means? I consider this the biggest hurdle for people actually wanting to use My Access, and I want to make sure people have the info on what that means, because that, I think, is the hardest thing for consumers to do.
Rachel, do you or Maciel, do you know about
The authentication of the My Access app, Rachel, correct me if I'm wrong, is just going in, creating your own Access account, and then confirming and formatting your own user ID and your password so that you can go ahead and create that. It is going to be the same on the desktop as it is on the mobile app.
Yeah, there's one follow-up. There's one step that I think is non-intuitive on that, and I believe it is using either a case number or a social security number
Oh, I
to link it
apologize.
to.
Yes, absolutely. So what you'll need is to have an existing account. You can use either your social security number, you could use either your forward health ID, or you could go ahead and use your PIN, and that's an ID number that they can access through their case account through the IM agency.
Awesome.
Sorry about that, Adam. I was missing it.
No, it's okay. I just think that's probably the hardest thing I have seen consumers struggle to understand about getting set up. Once it's set up, it's absolutely fabulous, and there's no reason that a consumer wouldn't be able to navigate it, wouldn't understand it, and use those notifications. So that's the easiest thing to get out of the way for everybody, though.
I agree.
Thanks.
Hey, Adam, this is Rachel. Just to add on to that, I know I mentioned earlier in the presentation that if somebody is doing the apply for benefits application to first initially apply for healthcare or food share or whatever, they don't need to have an authenticated account at that point. They just need to create their account, and it will ask for information to put in your user ID you want to use, your password, some security questions and things like that. So that's all you need to apply. But what Maciel and Adam and Michelle are talking about is once you've applied, and let's assume that you become eligible, at that point, the authentication process that Maciel was describing, that those extra pieces of information you would need, the reason for that is because then it sort of attaches your account to the information from your case in the CARES eligibility system, so that your information that you see in your Access account will have that information about your benefits. So that's sort of why that authentication needs to happen after you're eligible.
Great, thanks.
Great. Thanks, Rachel. Thanks, Maciel. Thanks, Adam. It takes a village to get this information out there, that's for sure. All right, so again, can download on the App Store or Google Play. You don't have to go to the DHS website to download it. All right, other resources. We have a guide to applying, and that includes information about who can enroll, how to apply, required verification, benefits and services available, rights and program rules, and fair hearings. And on our slide deck, we have a link to that document, and it's a publication, not a form. It's a publication, and it's publication 16091. The Enrollment and Benefits Handbook, we call that the E&B, is sent to all applicants and members. It includes information about benefits and services available, program rules, required verification, change reporting requirements, coverage services and prior authorizations, rights and program rules, fair hearings. And I know this sounds similar to what I just said, but this is for people who are applying or are members, typically members. And it's publication 00079, and it is extensive. I feel the information this is helpful and has can reach a wide audience regardless of Medicare Plus member, Medicaid member, food share member. Contact information. So the IM agencies who determine eligibility for Badger Care Plus and Medicaid, they're listed on the DHS website. We have the link right there on our slide deck. Also, aging and disability resource centers who offer enrollment counseling for home and community-based waiver programs. They are also listed in a link right there. And really, I would say aging and disability resource centers can help any of our members who have a disability determination, regardless of their age, adults with a disability determination. So regardless, I should say, regardless of their age, they need to be 18 or older. So not children, but they don't have to be 65 or older. And then anyone who does not have a disability but is elderly, which we consider 65 and older, they can also go to the Aging and Disability Resource Center and just ask for what they call it options counseling. All right, member services, general member questions, information about covered services, and help with finding a local IM agency. And that number again is 800-362-3002. And then Division of Hearings and Appeals, request a fair hearing. Again, people can do that through the Income Maintenance Agency, but they can also do it right through Division of Hearings and Appeals, DHA. And that's 608-266-7709. And then we have a link on that on the slide deck. And then for partners, we have information about Wisconsin's healthcare programs, including member fact sheets, and those can be found at the link on the slide deck. And it's the dhswisconsin.gov website, /forward/forward-health/index.htm. And you can really, if you just Google Forward Health Wisconsin, it'll also bring up the right page. So our online policy resources like policy handbooks and manuals and forms and directories can be found in the link on the screen. And then we've also linked, or on the slide deck, we've also linked the Badger Care Plus Eligibility Handbook, and we've also linked the Medicaid Eligibility Handbook. So those links are there for you on the slide deck and on the screen. They're out there for everybody.
Yeah, honestly, just real quick on those, not good resources for consumers, but for you, just, if you Google Badger Care Handbook, you can get a lot of your questions answered just by searching those documents. So kind of keep that one in your back pocket.
Great, thank you. And then we've got information for partners in Southeast Wisconsin. It's a PDF publication 01725. And if you know the publication number or the form number, if you put that in with either P or P or F, and then the number, depending on if it's a publication or a form, typically it will bring it right up in a Google search. I'm a big fan of search. Sometimes I can't find my links. All right, and then I think if we can put up poll question number 3, please. Thank you. I'm going to read that because it's just right in front of my face. And in most cases, healthcare benefits must be reviewed every fill in the blank month. How many months must they be renewed?
I'm honestly not 100% sure how long the time limit thing works, or if Mike could just close it after a certain amount of time. I'm guessing that doesn't take people too long to answer. All right, Michelle, you can see those results.
Yeah. So we had some answers for A, 6 months, and some answers for B, 12 months, and the correct answer was B, 12 months. All right, and then, sorry, I've got this. Okay, so any questions? Please direct all your questions related to Medicaid and Badger Plus to the email on your screen. dhsforwardhealthpartners@wisconsin.gov.
I'd like to just add a note. This is Maciel speaking. The Southeast Wisconsin partner link that was shared, it is for Southeast Wisconsin partners in terms of the HMOs that are listed on the particular document, in terms of the IM agencies that are listed on the particular document. However, the rest of the information on that document is statewide information. So it may say Southeast Wisconsin on the document itself. We're currently in the works of publicizing a statewide partner resource guide. However, just make note, for those of you outside of Southeast Wisconsin, you may find some of that information valuable, being that it's in one place. All the information is available on the websites and different locations and things of that nature, but we try to make it all available in one document as a great resource to have on your desktop or what have you when you're assisting your clients. Thank you.
All right, thanks, Marcia. Any other questions before we go to a short break between the sessions? I am not seeing any. I'm speaking really slowly just in case anyone is typing right this second. But I do believe that means you did a pretty good job with the applying using Access. And we will be going into more detail on the Badger Care Plus program in, I believe, 15 minutes. Mike, are we set to start back up at 10:15 or 10:20?
We are set to start up at 10:15.
Okay, well, let us all take a 12-minute break and go ahead and leave this program running, and we will jump back on at 10:15.